This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
From Philadelphia to Erie and from Scranton to Pittsburgh, it's Behind the Headlines. I'm Charlie Greenewalt, Senior Fellow of the Susquehanna Valley Center for Public Policy. I'm joined by my co-host, as usual, Maura Donnelly. Maura, welcome.
Hello, Charlie.
Well, Maura, now we know the truth about Bruce Jenner.
Oh, we do. The whole world does.
Yeah. He is a conservative Republican.
Yes, I heard that.
It was quite a revelation for some, apparently.
Yes.
We'll
see how his politics play out.
Indeed. Well, speaking along medical lines, today we're going to be looking at hospital care in Pennsylvania, and what better person to have than Andy Carter. Andy, welcome back to the show. You are the president and the CEO of the Hospital and Healthcare System of Pennsylvania.
Great. Thanks so much for having me back, Charlie.
Well, thank you very much for coming back. It's a pleasure to have you here. When we're talking about hospitals in Pennsylvania, and we have a new governor, a new administration, we have a new General Assembly, what does Governor Wolf's budget look like for hospitals in Pennsylvania for the coming year, Andy?
Well, Charlie, I'd say, put it in a word, it's grim looking. I'd say the administration is still getting its sea legs on how to approach health care as it tackles other priorities, and I'd say that the budget reflects an attempt to really undermine what hospitals are trying to accomplish, to transform themselves, to be better at providing the highest possible quality of care and as cost effective as possible. The governor's budget includes a total of cuts upwards of $166 million. Now, I would suspect your viewers, a number like $166 million is kind of hard to put in context, but let me try to do that. Over the last 15 years, we've lost something in the order of 44 maternity programs across the Commonwealth. When budget cuts make it hard to make ends meet at a hospital, people in communities feel the impact. Loss of services, jobs are lost. So this is very troubling, this opening budget.
Do you have any idea what the thinking is behind the cuts? It seems, well, as you said, grim. It's really rough. I mean, why?
Yeah.
Why?
I'd say that the administration is certainly struggling to meet the demands of a demanding budget, a tough revenue environment, expectations to invest in other sectors. But what we have to do is convince Pennsylvanians that holding the line on payments to hospitals, particularly through the Medicaid program, is in the best interests of our community health. We have a proposal to cut funding to 13 of our rural critical access hospitals, completely eliminate the funding that the state supports. And that's going to be devastating to access in our rural communities. And we know this will happen. We have, in the last few months alone, small hospitals have announced layoffs totaling over 100 people in a couple of smaller hospitals in our membership. And this kind of relentless downward pressure on payments to hospitals is being felt in these communities. And that's not to say that hospitals are not willing to do their part to make sure that we are being cost effective. The fact is we actually have to make progress while we continue our commitment to them. And, for example, we have something on the order of 35% of our hospitals in the Commonwealth who are losing money on operations. And even when you throw in fundraising that they do to help meet the bills, we still have about 28% of them that are losing money. That's not sustainable. And Pennsylvanians are telling us that they want access to the best possible health care. And this budget doesn't make that possible.
Mm-hmm. Could you tell us and our viewers about the history of the quality care assessment and how the hospitals contribute to the state?
It's an example of how hospitals are not just out there complaining about budget cuts. going back to 2010, we actually submitted a plan to the state to help it resolve a budget problem it faced then. We agreed to assess ourselves, to generate a lot of money, to bring in federal resources that allowed the Commonwealth to address some of its budget shortfalls. We were the only stakeholder group that came to the table with a plan and a solution. The trick is that they want to keep raising that assessment, but not make it possible to reinvest some of the federal funding back into healthcare in this new budget. That's something we just cannot support.
Where would the federal funding go?
It would go to help offset the general fund.
Oh, I see what you're saying.
And that's the problem for us.
Okay.
We're already doing our part. And in fact, in the last budget cycle, we contributed an extra $41 million to help the Commonwealth with its funding challenges. And we've been good partners in trying to make the budget work. But there comes a point at which we can only do so much and maintain the commitment that we make to provide health care.
Well, it sounds like the hospitals in Pennsylvania play a big role in Pennsylvania's economy.
Well, that is one of the, you don't want to cut off your nose to spite your face issues. We generate something on the order of both direct and indirect, almost 600,000 jobs in the Commonwealth. We know the administration is eager to kickstart the economy and to generate growth across the Commonwealth, but significant cuts to hospital payments when hospitals are generating so much economic activity definitely undermines that goal.
So that means significant loss of jobs, sounds like.
That's a huge risk, particularly in those communities where the hospitals are struggling.
Primary employer. Yeah.
And in most counties, the hospital is either the first or second most important employer in the community. And we really need to, if we're going to stay on track with our economic goals in the Commonwealth, we have to stand by these hospitals as employers. They're also, aside from jobs, just generating significant economic activity. This year it went up even more than over the last year. We're up to over $111 billion in economic contributions to the economy in the Commonwealth. So let's stay on track.
Well, I consider myself an expert on hospitals lately, but to me, it seems like we have some world-renowned institutions in Pennsylvania, and that these kinds of cuts are going to significantly hamper that status of, providing the type and the quality of care that we do in our hospitals in Pennsylvania.
We want to remain, as we are today, leaders in the world in providing the best medicine in a wide range of settings, both in large urban centers, but also in our smaller communities. Pennsylvanians have come to expect that, and they are also expecting us to continue to make health care more convenient and easier to navigate. We all know that billing, for example, is a real challenge.
Yeah.
When you get a hospital bill, we acknowledge that it is complicated, and we are doing a great deal of work to simplify that whole process. We're also doing a lot to make it easier so that people can move around the healthcare delivery system, not have to keep filling out the same form, providing their address and their name and their medical history again and again and again on paper, but instead to be able to have access to electronic medical records that make it easier to navigate through a complex system. How can we continue those investments if our partners, both in the federal level and the state level, don't stand by us? They account for roughly half of all the revenue that goes into Pennsylvania's hospitals. They can't walk away and expect all of us not to notice.
Well, you said that the hospitals, Pennsylvania hospitals, account for about 600,000 jobs across the Commonwealth. And if it's the spin-off effect is approximately the same as we find in most other industries, that means that there are three secondary jobs for every primary job. So your spin-off effect would be 1.8 million.
Well, actually, the 600 includes that spin-off
effect. Oh, it does
effect.
include that.
Exactly.
Oh, I'm sorry.
Yeah, sorry. So that's the total direct and spin-off effect.
Oh, okay.
So substantial, without question.
Oh, yes.
And we have plans across our membership for continuing to meet expectations that consumers are putting in front of us. We survey our patients and their families with every visit to find out how we're doing, and we know generally we are meeting and exceeding the expectations of consumers. But those expectations are rising, particularly as they begin buying insurance products that have them having more skin in the game. Higher deductibles, higher co-payments, and as a result, they're looking very closely at the quality of care that we are providing, and they're shopping more aggressively than they ever have before. And that's good. We believe in a very competitive environment. We believe it's appropriate for consumers to hold us accountable. But again, $1 out of $2 is coming from Medicaid or Medicare. We need them to remain in the game.
Well, as we know, the governor's proposal is just that, a proposal. There's still a lot of wrangling to go. What's the plan? What are you going to be doing on the Hill in the next several weeks to talk about the need to not make these cuts?
Well, exactly that, Maura. We are talking to legislative leaders about the importance of the investment, reminding legislative leaders that we are already at the table with revenue solutions that are significant and meaningful, and asking for their support. And we also continue to work with the administration to identify strategies that make it possible to support a balanced budget, but not on the backs of Pennsylvania's healthcare consumers, for sure. It's going to be a long road. Talk around this town is that we may not hit a June 30th deadline for completing
I've heard
the
that
budget.
too.
We're certainly preparing for that possibility. We are asking our members and the patients they serve to communicate with policymakers and make clear that as we craft a balanced budget, that we do so in a way that retains our investment in health care.
So the governor's proposed budget would not only downscale the availability of hospital resources in rural areas, Andy, but it also affects burn centers. I think, is it 6 burn centers
6
would have
burn
to be
centers.
closed?
Well, they would lose
funding.
They would lose special funding that they receive to help cover the cost. Burn centers.
What would the effect for Pennsylvania's population be to have that happen? What would, if those burn centers are downscaled, what happens to the availability of those services to the average Pennsylvanian?
One of the values of burn centers is that they concentrate expertise, and they allow the professionals and the clinicians that are working at these burn centers to develop a very high capacity to serve badly injured patients. And if they lose this special funding, their ability to continue to provide cutting-edge service to burn victims is undermined. Our members are going to do everything they can to hold things together. I'm not saying that these burn centers are going to close, but I am saying that their efforts to remain cutting-edge organizations serving patients is undermined by these kinds of cuts. And we have to work with policymakers to reverse that proposal.
So if you want our viewers to do anything, where can they go for additional information?
Definitely come visit our website at haponline.org. They can find information about expected impact of budget cuts. They can learn more about burn centers. They can learn more about our obstetrics units. And they can learn more about the work we're doing to support healthcare improvement, quality improvement, and cost-effective care.
Okay, Andy, we want to thank you very much for being with us today. And we hope that you'll come back soon as this budget is cobbled together.
Yeah.
And we'll see if we meet our July 1 deadline or not. But
Right.
Thank you for being with us. We'll be right back with the second segment of Behind the Headlines right after this.
Behind the Headlines is brought to you as a public service by the Hospital and Health System Association of Pennsylvania, helping hospitals provide healing, health, and hope to communities across the state. And by the Pennsylvania Business Council, envisioning a commonwealth in which residents enjoy a very high quality of life in sustainable communities. The Council works aggressively to define key long-term policy strategies and solutions to make the commonwealth more competitive, creating and sustaining a better Pennsylvania. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by Daily Express, transporting construction, farm, and industrial equipment throughout the United States, and by Blackford Ventures, LLC, a private equity firm seeking to make significant investments in real estate, proven business enterprises, and their leaders. Find out more at www.blackfordventures.com. And by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Visit pahighwayinfo.org.
Hi, welcome back to Behind the Headlines. On this segment of Behind the Headlines, Maura and I are going to go from hospitals to townships and just continue to talk about budget problems. But of course, Maura, just recently in Pennsylvania, we've had one of the premier events in Pennsylvania politics and government, and that is the Township Association, Township Supervisors annual conference. And
their 93rd year, I understand.
93 years.
Yeah.
And
someone who wasn't around.
We were not around for the first one.
And our guest was not here either 93 years ago.
Well, we're fortunate to have with us Dave Sanko, who is the Executive Director of the Pennsylvania State Association of Township Supervisors. Dave, welcome back to the show.
Thanks for having us.
Well, we're very happy to have you. This is a big event, not just for your association, but for Pennsylvania government. You bring in township supervisors from all across Pennsylvania into the Hershey Conference Center?
Into the Hershey Conference Center, we bring about 4,000 people
for a week
into town for 4 days, Sunday through Wednesday. A couple days there. A lot of educational programs, seminars, many of which were standing room only. Some general sessions, a lot of good speakers: governor, lieutenant governor, auditor general, the Speaker of the House, the leader of the Senate. Just phenomenal presentations, and we had a legislative reception with over 100 legislators visiting as well.
So it's a chance not only for them to network, but it's a chance for them to learn all the new things that are out there. And you're bringing in speakers and the people who are leading the way in innovations for township governments across the country.
Yeah, I think it's learning on both sides. It's learning for our members to get to hear from the leaders in Harrisburg, many of whom are new in their roles, but it's also an opportunity for the folks in Harrisburg to get to hear from local elected officials who are serving the same constituents, living the same problems, and in many instances being innovative, and those innovators who are crafting common sense solutions that wouldn't hurt to surface in Harrisburg every now and then.
And so what are your township supervisors saying right now? What are their biggest concerns?
Well, I think there was a lot of discussion about the natural gas fees and the impact fee versus the severance tax. There was obviously a lot of discussion on the transportation funding, which was a huge addition to local governments from the result of the last couple of years, but also looking towards federal funding solution. There was some discussion of unfunded mandates, and then a little bit of discussion on pensions, municipal pensions. But the larger point there was that it's not the big problem that for many of our members that are being portrayed in some of the cities.
Well, going back to talk about the new governor, Governor Wolf, and his plan is to replace the impact fee that the gas companies pay to the townships and the local governments where they operate, to replace that with a severance tax. There's both good and bad in that for the state and for local governments, isn't there, Dave? Could you sort of give us a chart on that, the pros and cons?
Sure. Well, the impact fee, when it was crafted as a result of the Marcellus Shale Commission that I had the opportunity to serve on, was actually a really innovative model in that it didn't, nowhere else in the country was there an impact fee. Where money was being able to be directed to local communities and those communities that are impacted. That fee has generated in excess of $600 million over the last several years into local communities that have helped fund public safety initiatives, fund transportation initiatives, fund water and sewer initiatives, planning initiatives, all kinds of things that impacts that were caused by the industry, which is in addition to being a positive economic engine, did bring some changes to communities. So we were very concerned about the prospects of losing that funding. And the way Act 13 was written, if there were ever to be a severance tax introduced, the impact fee would be eliminated and would go away. So you'd go from having an ability to have that funding to not. So the good news is that in Governor Wolf's proposal, he wants to maintain that level of funding, so that was in the impact fee to be carried over into a severance tax model, which is good news for local governments. It could be bad news for local governments in that they're depending on how it's written. I mean, it could be if it's the first dollars in, that's wonderful. If it's the if we got to find the leftovers after we hit the first billion for education, probably not so good. And the other thing that is of concern is that the current proposal from the governor caps that funding at $225 million. Now that's the largest amount that was paid in a single year, and it would guarantee that level regardless of the whether drilling went up or down. But obviously, as we move into the future, the likelihood of drilling expanding versus declining is greater. So we're concerned. We think that money ought to be able to float with the market and with the amount of drilling that's going on. So if drilling goes up, the available funding goes up. If drilling goes down, the available funding goes down. We're not looking for guarantees in bad times, but we would like to have the opportunity to have the benefit in the good times.
So it sounds like the devil's going to be in the detail when we finally see what the proposal actually looks like, correct?
As is often the case in the writing of legislation.
Yeah, so you're going to be staying right on top of this for your members.
We will continue to monitor. It's a big deal for.
So it sounds like it could go a couple different ways. So you have to keep an eye on it.
There are a lot of options. Yeah, we have to watch.
Pension reform, you said, was being discussed at your conference, and you said that the House Majority Leader, Mike Turzai, was there, and the Auditor General, Eugene D. Pasquale, was there. And they both have things to say about pension reform, too. What are some of the things, I believe you have a little bit more information from behind the headlines that you can share with us about pension reform in Pennsylvania, Dave?
Well, I think everybody is well familiar with the headlines of the pension distress at the state level between the state employees and state teachers in excess of $50 billion with a B dollars shortfall. Municipal pension shortfall is about $7.5 billion. $6.5 billion of that is just the city of Philadelphia. So as you look at the large number of municipal pension funds, 90% of them are either completely funded or only minimally distressed, and only 10%. Actually, only 2% are severely distressed, but 10% are funded at below a 70% level. So that's really not a lot of communities. It's a big problem for those communities that have the shortfall, but it's not a big problem for most communities. And one of the concerns that our members had was the idea of a suggestion of consolidating all the pension funds into a single pension fund. Well, we don't have to look too awful far to see how that story ends. We've seen two other ones that have huge shortfalls, and the idea of taking the positive fund balances from the 90% of the communities that have done it right and using their revenues to help balance the budgets in the 10% of the communities that didn't get it right doesn't seem to be a good idea.
I understand the governor came to your conference, is that correct?
He did.
And how did that go, and how's your relationship with the new administration?
I think we are optimistic. We're still learning, as everyone is. The governor has been very open and willing to talk, doing things differently than prior governors, but still open to those suggestions, and seemingly to date, we'll see as we move forward. We seem to have good partnerships.
One of the major problems across America has affected Pennsylvania as well, and that is the decline in volunteerism. And we find here in Pennsylvania we rely heavily on volunteer firefighters. I believe this was one of the topics that was explored at your conference too, Dave. And I believe your association has a very good relationship with the state fire commissioner, Tim Soloway. Did you folks come up with some ideas on how to deal with or approach this shortage, this looming shortage of volunteer firefighters in Pennsylvania? Sure.
Well, I think there's been a lot of focus on it for a number of years. As you know, I in a prior life had been the State Director of Emergency Management, so have a little bit of background in this. Townships are on the front line of emergency response and for providing public safety, including fire, police, and EMS. Firefighters are volunteers in most of our communities, and if we were to lose the volunteer firefighters and go to a paid fire service, it would cost $6 billion. Wow. That's a lot of property tax increases to have to pay for that. Jeez. So there's all kinds of incentives for all kinds of reasons for everybody to try and incentivize the growing of the volunteer base for those in the fire services. People that are in fire services are a special breed of people. When a building's on fire, most of us run out. Yeah. They run in. Right. You need folks who are going to do that. We need to try and incentivize it. There was a Senate resolution 10 years ago that put out some plans for ways to do that. We're continuing to push forward with that. We've talked about partnering with the fire commissioner and the PEMA director and traveling around Pennsylvania and doing a road show, if you will, in communities, talking about the importance, the important integration between local governments and emergency services and the public.
Well, what are some of the incentives that are, just a handful of those that have been proposed?
Well, I think the idea of college tuition for volunteer fighters, reimbursements, property tax relief for volunteer firefighters at the federal level. We're trying to, and we'll be going to Washington in very shortly to talk with members of Congress about trying to incentivize volunteer fire services and getting a tax deduction on your federal income tax, something that is currently not there.
Wow, those would be great incentives.
Just one last thing in the last minute that we have, Dave. I just read a little report in The Economist of how Japan is trying to address some of the needs of their local government. So many people have left the countryside and have gone into the cities, but they still have attachments to the countryside and their local government that they may have left. And so you can take a deduction, take some of your tax return that's due to the federal government, and you can designate it for your local government. And then you can designate up to something like 7% of the amount of money that you owe to Tokyo goes to your local government instead. Wouldn't that be nice to have something like that for townships at the state level?
I think from a funding perspective that would be attractive, but if we were to go with the surveys in Pennsylvania and see that, almost 2/3 of Pennsylvanians trust their local government more as the most trust level of government, they do that voluntarily. 25% trust the state and 10% trust Washington the most. I'm not sure who those folks are.
Dave, thanks again for being with us, and we'll see you again next week on Behind the Headlines.